Assalamualaikum. Hi everyone. So now I would like to show you all how to do tuning fork examinations. Okay, so before we learn about tuning fork examination, let us go a little bit on the anatomy of the tuning fork. So this is a tuning fork. It have two prong. It have neck, handle, and also the base. So when you want to do the tuning fork examination, your hand is at the handle. Don't touch here at the neck, and of course not at the prong. Why? Because you will disturb the tuning fork's vibration. This one I'm using tuning fork 512 Hz. So it's mid frequency. So I'm testing now for mid frequency. The base is when you want to put on the patient. The base on the patient, your hand at the handle. Okay, 1. 2 is when you want to do tuning fork examination. When you want to put in the patient external ear canal, remember that this prong have to be at parallel to the patient's ear canal. Usually people will do like this. Why? Because ada shoulder kat sini. So you tend to do like this. This is wrong. Why? Because the sound is from prong to prong and the wave travel. So this is the most optimum traveling wave of this tuning fork. So what you need to do is you have to put it not like this, not like this. If this is the patient's ear, so this is the patient's ear, you didn't put like this. Prong is like this to the ear. You need to put like this so that the prong is from this prong to this prong and travel to the patient's ear canal. 2, it have to be parallel. So the prong and the prong is parallel to patient's external ear canal, not like this, not like this. Usually it's like this. No, it's prong, 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 and at the same level of the patient external ear canal. Okay, this is for air conduction. Okay, so for examination of the tuning fork, today I would like to share about Rinne's test and Weber's test. Rinne's and Weber's test. Okay, so Rinne's test, there's 2 parts. One is you give air conduction sound. 2 is you give bone conduction. Where? Bone conduction at the mastoid. Air is from the outside prong to the external ear canal, and bone conduction at the mastoid process. So how you do it is, first you need to strike the prong. Where you want to strike the prong? You can strike anywhere near you, but you have to be somewhere that is hard and also soft. So it's not too hard like a glass or a metal. You find something that is hard and also soft, for example plastics. So usually we didn't strike on the furniture. Usually we strike at ourselves. Where it's hard is at the elbow. Usually we strike at the elbow. When we want to strike, we strike not over tune. Ting! No, that is wrong. That is not air conduction. There's conduction to every ear. No, we just want to test the patient's air conduction. So you just strike and you hear. Instead at here, you cannot hear. When you put in your ear, then there is sound. There is sound. So you is normal. So you hear. Then you put the patient and you ask the patient, can you hear? first you condition the patient. So this is the sound that you want to hear before you start the test. So you want to tell the patient this is the sound that you will hear. So you try again. Now you want to do test. You hear first. Oh, I can hear the sound. Put parallel to your ear canal. This is Rinne's test. You put at the patient external ear canal. Look that I put at the prong is parallel to external ear. So this is air conduction in Rinne's. Bone conduction is you need to try again. You hear. I will hold the patient's head. Why? Because I want my base to be tightly adhere to the patient's head, to the patient's mastoid. So I will use my other hand to hold the patient head. Tapi tak ada sebelah kepala dia, susah. So susah sikit. So you put here at the mastoid area. Remember when you do this, you strike, you put at the external ear canal, put at the mastoid. Remember your hands is only at the handle. You have to practice. You cannot put your hand on the shoulder, on the prong. No, it only at the handle, so you won't interrupt the vibration of the tuning fork. Okay, then you ask the patient, which one that you hear better? You hear better in front or you hear better at the back? Okay, so as you condition for the sound, you also need to condition the patient for the side. So you tell the patient, you strike, you hear. Say, patient, this is in front, this is back. Okay, so you tell patient again, this is front, this is at the back. Okay, so you condition the patients first. Some clinicians, they use A and B. Do you think that A is better? You hear which one better? A better or B better? I usually use in front and back because A and B usually patient A, B need to condition a lot in the patient's brain. So because here is depan, this is belakang. Usually patient will understand that better and can respond very well. Depan and belakang, and ask patient yang mana lebih kuat, which one you hear stronger, the sound is louder, depan atau belakang, in front or behind, or posterior or behind, in front or behind. So that is Rinne. So in front is you test for air conduction, behind you test for bone conduction. Okay, so that is Rinne. Now we go for second test. Second test is Weber test. Weber test. Weber test usually we put at the middle, at the forehead here. What we do is actually we do a bone conduction. Bone conduction. Because this is mastoid, the whole skull is the same bone. So we want to do only bone conduction. So we want to test the bone conduction. So we want to test for the cochlea. Okay. So now you strike, you hear, yes, you hear, and then you put at the patient's forehead. Nampak? At the patient's forehead here, tengah-tengah. And then you ask the patient which side of the ear that you hear louder. Your right ear or your left ear. Tak left ear dia, ada left ear. Which one you hear louder? Sebelah kanan ke sebelah kiri? You want to hear which one? You want to ask the patient which cochlea hear better, which ear hear better, the right side or the left side, because we didn't test the external ear dah ni. So it's direct to the cochlea and go to the nerve, to the brain. So this is bone conduction. So Weber only test for bone, is only that we ask right and left which one is better. Rinne we only test for the specific ear. Specific ear. Okay, remember you need to sit for otoscopic examination and also Rinne and Weber examination. You need to sit at about the same level of the patient. level of the patient. So this is your patient. Okay. So how to interpret Rinne and Weber, and also okay, we will discuss after this. Bye.